I'm 20 weeks pregnant and cramping.
Leg cramps are common at this point in the pregnancy, though getting enough potassium and other minerals reduce the risk of it.
This isn't leg cramps.
At 20 weeks along, some women get leg cramps so bad it wakes them up at night. You could ease it by straightening the leg then flexing, though for back pain, shifting position or stretching would help.
I have had some leg pain.
If you're having pain in one leg but not the other, maybe with or without cramps, with or without swelling around the painful site, you may have a blood clot in one leg.
And I thought swollen ankles were annoying.
It isn't uncommon to have back cramps due to all the extra weight you're carrying.
It is like 10 pounds.
You're carrying a cantaloupe-sized child and amniotic fluid that makes it like a basketball up front.
This isn't just a minor back cramp.
Remember that if you lay on your back this far along, the weight will press on the blood vessels in your back. That can cause numbness or pain in your lower back and legs.
This isn't localized or generic pain, but cramps.
You'll feel some twinges or even occasional pains as tendons stretch to accommodate the growing load.
Are you going to tell me to get a pregnancy girdle?
If you develop girdle pain due to carrying that load, yes, a girdle might help. So might a pregnancy pillow.
And all this while, I'd been looking at nursing pillows. But I'm having bad cramps.
Are you drinking enough water and getting enough fiber? It isn't uncommon to have really bad constipation when you're pregnant.
I know what constipation feels like.
Pregnancy requires more water intake while the hormones to relax all those tendons so the uterus can expand slows down digestion, hence constipation and indigestion.
This is way more serious than indigestion.
If you are having cramps that keep going and going, you may need to see the doctor.
That's rather generic. How do I know it is serious?
If you have serious cramps plus blood, you need to get to the emergency room to treat the miscarriage.
Miscarriages usually happen in the first trimester.
Yes, and at this point, regardless of whether you call it a miscarriage or a stillbirth, you need to get to the hospital in case you need a blood transfusion or antibiotics.
Now I know why you suggested indigestion first.
If the cramps are minor but not severe, they can be due to muscles straining as you twist, turn and bend against a growing uterus.
I know it is moving into the middle of the stomach instead of being low in the pelvis.
If you have dehydration, you can get cramping in your stomach, back and legs.
That's a new reason to drink a lot of water.
So is a bladder infection. Some women get cramps as the bladder strains to empty and the pain as it fills with fluid it can't all evacuate.
I didn't know that, and I'd hate to say it would be the only time in my life to say I was happy to say I had a urinary tract infection versus something worse.